we say yes right. And so when I see students coming here, we're getting the best students that want to be Creighton Blue Jays because we give them so much opportunity and then they take it and run with it.
Welcome into From the Mall, a podcast where we share stories from the Creighton community that showcase achievements and impact. I'm your host, John Niatawa. On today's episode, we're focusing in on Creighton's College of Nursing, which is enjoying an incredible moment in its history. Record enrollment, a national designation for faculty expertise, new programs and initiatives, and so much more. We're joined by Jessica Clark, Dean of the College of Nursing, to discuss it all. Plus, as someone who just arrived on campus in 2024, after previously serving as Dean of the College of Education and Health Sciences at Bradley University, we get to hear Dean Clark's perspective on everything that makes Creighton such a special place. I'm excited to chat with you because right now, I'm sure being the Dean of the College of Nursing is always a great job in the course of history at Creighton, but right now in particular seems to be a really exciting time.
Yes. I'm having an absolute ball. I can't believe I've been here 2 years. 2 years I've already been here. So
What has made these 2 years special for you? Loaded question, I know, but why does there seem to be so much momentum in the College of Nursing right now?
wow, I have incredible faculty and staff and what as well as students, right? And so I think it's one of the things that really attracted me to Creighton is I've worked a lot of places in higher ed and outside in healthcare, but it's really hard to find an employer in a place special like Creighton that really truly lives their mission each day. And that is true. I mean, the only other place I can tell you that I've actually seen it lived out every day is the VA. I worked most of my clinical career with the VA, very focused, right? We were taking care of veterans. But to hear about the Jesuit values and the mission that we have as a Jesuit institution, you can talk all day long and talk a big game, but to actually walk across campus and see it in every single interaction with a student, with your peers, with your boss, right? That's truly incredible. And I've seen it each and every day.
Did you expect that? I don't know if you knew what to expect.
No, reputation wise, brand, everyone knew Creighton, right? I mean, I'm from the Midwest. I knew about it. I mean, you hear about basketball, I'm from Indiana originally, right? Basketball is it. But it was no, I mean, I'll be honest, I was a little apprehensive because I wasn't Catholic. So stepping into a Jesuit institution, and I'm like, well, I'm not Catholic. Is it gonna be okay, a good fit for me? Do I have to be Catholic to work here? All those things went through my mind. And what I found was no, I mean, every single faith-based, denomination, truly embraced here, right? Even non-faith believers, right? It's just such an incredible place. Every day.
Yeah, I think that your point about seeing sort of the Jesuit values, this sense of community, a welcoming atmosphere ingrained in every conversation, every interaction that's pretty spot on. I
Yes.
feel like if anyone who's been on campus before, even whether it was last week or 2 years ago or 20 years ago, knows that sort of feeling. It hasn't left. It's still here.
And even the Omaha community, right? I remember coming for the interview and I was walking downtown in the old market. I saw this elderly couple walking arm in arm. And one that told me, one, it's safe, right? But then secondly, they were talking about the basketball score. Hey, did you see those Jays? And the enthusiasm the community has and the support for Creighton is incredible. Yeah.
And students are really impressive.
Yes.
Every time I get a chance to talk to students and hear from them about what their goals are and how they hope to achieve them and impact the lives of others, I always come away really impressed. What's your impression been of students so far in your 2 years?
Oh, at every single one of them set apart, cream of the crop. Their engagement in the classroom, but also their interest areas, extracurricular. I mean, the fact that a lot of them are coming here for global immersion. So I love that because we have opportunities for our students that, quite frankly, other institutions that have nursing programs don't allot to their students. So many nursing programs across the country will say, well, if you're a student athlete, ooh, you better not do nursing. Or, oh, you want to study abroad? Can't do that here, right? We say yes, right? And so when I see students coming here, we're getting the best students that want to be Creighton Blue Jays because we give them so much opportunity and then they take it and run with it. Research, no different, right? I mean, I think as an undergraduate student population, our nursing students are working hand in hand with faculty on research. And again, in nursing schools, that because the curriculum sometimes is so prescriptive and it's overprescribed and pretty rigorous that a lot of the times there's just no room for anything else. Again, Creighton says, oh yes, you can, right? You want to be a researcher, we're going to make you a researcher as well. So
I wonder where, when you took the job and you kind of got an assessment of where the college stood, where did you start? Like, how do you go about sort of like, hey, this place is great. I
yes.
love it,
Yeah.
but I think there's X, Y, and Z I can do to help improve it and make it stronger.
Yeah.
So where do you start? How did you determine that?
Well, it's always nice when there's a solid foundation, right? I've been in numerous opportunities and jobs where that's not been the case, right? You kind of come in and then there's things on fire, literally sometimes, right? And so the fact that Dean Tadero, right, my predecessor, had been here, and had really done such a great job, right, with elevating our portfolio in the market, and just what she was doing made it really incredible. She's become a fast mentor and a friend, which is incredible too, because in the world of nursing, that doesn't happen a whole lot. Someone retires, you don't see them again, right? They're like, I'm out. But she's been great. She's still in the community. But I think having that really solid bench has been really important because I just get to come in and elevate it, right? So enrollment was already strong. But I just again took it up a notch. And so we've been able to elevate enrollment. We've increased enrollment over 50% in the undergraduate population. Again, nationally, we have a shortage of nurses. So I'll turn anybody into a nurse I want. And so coming in and really kind of redeveloping, reestablishing that rapport with our clinical partners has been really instrumental. Again, great community support for Creighton. They have needs for more nurses and paramedics. I think that was the other thing for me that attracted me to Creighton was I was a previous trauma and ER nurse. What better portfolio to come in and have paramedicine and nursing? I mean, where am I going to find that, right? But coming in and saying, okay, we're doing really great work, but how can I just keep elevating the really good work that we're doing? And a lot of that momentum was already here. So this year, as an example, we were designated as a center of excellence with the National League of Nursing. That wasn't me. That wasn't overnight, right? That was a culmination of the past 10, 15 years. I just went out and helped get the recognition for it, but the work had been done, right? First in Nebraska, right? Which again continues to make that effort. But great clinical partnerships, Common Spirit, Children's Nebraska, the VA, the Med Center. All of those shortages have really helped us because we have a reciprocal relationship where they have shortages and I say, well, I have really qualified students that want in the door and I have more and more that want to come to Creighton. So how can I increase enrollment? How can you give me more clinical placements? 80% of our students come from outside of the state of Nebraska, but I've made it a goal here at Creighton that I want 50% of them to stay in Omaha. And we're close. We're about 40%. We're getting there. So
Something to ask you about in a
yeah,
couple years.
yeah,
Well, two things that you mentioned, but I want to start with enrollment.
yeah.
It is up, record enrollment, right? For the College of Nursing.
It is. We just took our largest class in history in the fall, and we're on track to do it again. So we were previously taking about 140 of our traditional freshman class. I increased it to 225.
Wow.
Yeah.
Why do you think that has? I mean, it's probably a lot of what you've just been talking about. Our momentum was already in place.
Yeah.
A lot of things that you and your staff have been able to just kind of elevate. But I don't know, have you pinpointed one or two things that have really stood out in terms of like what's made it maybe more attractive for students to choose Creighton?
Well, we talked about that culture, that dynamic, that Jesuit foundation. But for me, it's also the facilities and the investments we've made across campus. So the Werner Health Science Building, the way that we are now training students, particularly in health sciences, together, right? As a prior nurse manager and healthcare administrator, I would see all the time, physicians and social workers and nurses and PT and OT. They knew their job really, really well when they came out as new grads, but they struggled integrating care. They struggled understanding everyone else's role. What's so unique about the opportunities in Werner is that we're all under one roof. And so now I want those students, and they're playing well in the sandbox well before they get out into practice. So they're going out more practice ready, and our employers are already telling us they can see the difference, right? So that's really important. I would also say that my faculty, right? You get a new crazy enthusiastic dean that comes in and I'm like, I'm bringing up enrollment and they're like, "Oh no," right? But they just said, "Yes," right? We want more nurses too, but hey, by the way, we want more faculty, right? But again, having a really supportive administration, Creighton is so doing well financially. I think in the climate and the environment where there's a lot of institutions that aren't as fortunate to be financially stable as Creighton, that's incredible, and that's allowed me to increase enrollment because I can make more investments in faculty and new programming, right? Which is pretty incredible too in this climate.
Do you think that students feel this? Like, do they? I don't know if they recognize like, hey, there's more.
There's more people. There's more. Yeah, like, they do.
I don't know if they. Maybe it's the question is like, do they recognize the momentum and the excitement of like, hey, we're doing more and
I try to get in front of students a lot. I think that's it's one of my little niche areas. Is I'm pretty, I bring a lot of energy, right? It's kind of scary sometimes. I had an evaluation once that said I was terrifyingly enthusiastic, and I thought, I like that, right? But I'm engaging as much as possible. So we're talking about that because I don't want quality to suffer, right? Just because I'm increasing the quantity, right? So talking with students to say how best can I help you succeed in the classroom, because retention is really important. College of Nursing has a 92% retention rate from freshman to sophomore. That's huge, right? When national averages are in the 60s. So I talk to students all the time and I say, what can we do to help support you to get to the finish line? So we're also making really great investments in things like tutoring, right? In the College of Nursing, academic advising, right? A lot of things that we're doing. And those are all ideas that have been coming from students, right? To say these are some things, extra support that we need as we grow.
I've talked to a few College of Nursing students, and they, I don't know if they, I think they understood the challenge and they were going to be tested academically.
Yes.
And like, obviously, you're going to learn a lot of the skills, but it was not going to be easy.
Sure.
And I think they recognize it. That's like one of the first things I say. It's like, yeah, it's not easy.
Yeah.
Like,
Nor do I want it to be easy, right? Because as you're sitting there in the hospital and you have to have a procedure, I don't want easy coming at you, right? I want some academic rigor, but I also don't want it to be impossible, right? I really do think that anyone can be a nurse, and sometimes some people need additional support more than others, or it's just a difference, right? Those students coming straight out of high school is so different from college, and we spend a lot of time that first year really trying to acclimate them to, hey, how can we get into the college mindset and what does that mean? Things that would have worked in high school may not work in college, and so it's really getting over that hump. And we have, we've got about 3 semesters to do that before they hit the major that sophomore year, second semester. And again, we must be doing something right? Because our retention's high, our students seem to be happy and satisfied, as well as our faculty. But that's also really important to me. I always tell people there's a big focus on student success, and that's really important. But I have to have faculty and staff success well before I have student success, because it's like pushing a cart, up a really steep mountain without having that support. Your faculty are integral parts of student success.
one thing that I thought was really cool, I think you've spoken about this before, but like faculty in the College of Nursing, here at Creighton, they go out and they volunteer or they actually log professional hours on the job.
Yes, I do.
Which I'm sure isn't that probably happens across the country, but I feel like the point of emphasis here is it's high on your list in terms of letting faculty sort of, I don't know, hone up their skills or at least be in the field on the job.
Yeah, we call that a day of practice, right? Some universities will say, yeah, you can practice, but as a college, I'm going to keep your pay, or it has to be a supplemental contract. You can't do it during your Monday through Friday time. For me, it's very different. I want my faculty encouraged to practice because I don't want them to go 30 years without actually touching a patient. And they bring that experience and that enthusiasm from practice into the classroom. So you're going to see a lot of our faculty that are still in their specialty areas working in pediatrics and neonatal psych, community health. You're going to see all that. And it makes that learning experience for students so much more robust. And it makes my faculty happy because many of them became nurses to practice and then they pivot into education and they miss with being with patients. Sure. Right? Yeah.
Okay, so the learning experience that you mentioned, Creighton nurses when they graduate are ready. They're prepared. what kinds of things, I know there's been a lot of investment in terms of technology and innovation to help students learn, whether it's VR, AI, a lot of things that Creighton does that's really cutting edge to make sure that students are ready to go. What types of things are offered at Creighton? Could you kind of talk a little bit about all the things that
Yeah. So
that students can learn?
yeah, to prepare. I think aside from obviously our traditional labs and our simulation with Werner, right? We're dissipating anxiety before we put those people into a clinical setting. They're also getting almost 1,000 hours of direct patient care. So the state of Nebraska, as an example, says, wow, you only have to have 500. Again, we're like, we're above average. We're going to do 1,000, right? So they're getting a lot more hours. And that's a true testament, again, to our faculty and our clinical partners saying, please come as much as you need to. So that's really great. We start those students doing NCLEX style questions. So they graduate, they have to pass, the big test in the sky, the NCLEX RN. We start training their brain from day one. So when they hit those nursing classes, we're really challenging them and teaching them the way of the NCLEX exam. So we don't wait till senior year. We do it all the way through the program. And so that's truly important. Other things that kind of I think differentiate us, you talked about AI. Um, Lindsay Iverson, Melissa Taylor, there's a couple of really excited faculty that have been working interdisciplinarily with our arts and sciences friends. So Dr. Stephen Fernandez, who have created a chat bot within different courses, if you will. Some of those courses that are a little bit more troublesome, right? So think about pharmacology, maybe even areas of practice that are hard to actually get experience in clinical. So think about having a really difficult conversation with a patient. Maybe they're dying, or maybe one of their loved ones has just died. Those are things that are hard to practice. And so they've created an actual AI chatbot where they can practice those difficult conversations. They put a rubric together with it, and then they get immediate feedback. So, when their faculty member isn't available, or it's 2 o'clock in the morning and they're trying to quiz themselves on some, antibiotics, right, that they have to give the next day, this technology is enabling them to work on that skill outside of the classroom. So it's pretty unique. One of them we're actually working on is called RX24 RXRN. And that's this amazing technology. But again, we're not afraid of AI. We want to be leading that effort because we know our students are going to be using it in the workplace. And so again, that's just one of those innovations that you can see the College of Nursing kind of saying, we're grabbing it and we're taking hold of it.
It does seem like not just, I mean, this may be a little bit separate from AI, but just in the conversation of healthcare, probably true across history, but like every week, every month, like something is changing.
Yep.
You really have to stay on top of it if you're an institution that is trying to educate
Yes.
go to the next generation of leaders
Yeah.
in nursing. Like you got to be on top of it. So
Yeah, and to be fair, I mean, technology will change quite frequently, but I've never seen so as much disruption as I have within higher education and even practice them with AI because of how fast the speed of the technology has been integrated. And so that puts our faculty on their toes quickly to be able to pivot and to adapt. And that's what I love about my faculty. Anything that's thrown at them, literally, right? They grab it and they just go, "We got this," right?
Yeah.
Not only do we have this, but we're going to be first to do it, or we're going to develop it ourselves, right? So that's a pretty incredible feeling. Yeah.
I'm sure that you do spend time thinking about also what is next,
Yeah.
as best as you can.
Yeah.
But I don't know if you can summarize or discuss some of that. What do you think is the future for this college? Like
Sure.
when you map it out, talk about what we can accomplish, where we want to be, what kinds of things do you say?
Yeah. So when I came in, one of the things that I did was we developed a 5-year strategic plan, and we did it in lightning speed because I kept getting asked right when I started, what's next for the college and what are you going to do?
Yeah,
I was
everyone
like,
always wants.
what's next, right? And I'm like, well, you know what? Listen, it's not all about me, right? I just get to be the face of the college and lead all these amazing efforts. And so I really worked hard. And in about 9 months, we had a full strategic plan developed. And I was really impressed with everybody because sometimes those strategic plans just kind of drone on and on. But there are five big areas of interest. One of the largest ones is how we elevate our research portfolio, how our faculty can enhance their extramural funding, right? And federal grants and foundational support so they can help really build up the funds they need to do some really creative, innovative research, right? Again, to keep Creighton on the map. And again, student integration, right? How can we work with those undergrads to really teach them, but also get additional support? New programming, I think I mentioned that. We have a great Phoenix Health Science campus. The only program that we have out there right now from the college is an accelerated nursing program, but we're looking at how we're going to bring paramedicine out to Phoenix. Last year, we were given a congressional earmark that paid for a simulation, an ambulance simulator. So there's a lot of opportunity out in Phoenix with their growth to look at what's next in paramedicine and some of those continuing education trainings for the market. But I think really cool and something that graduates, alums have been asking for years is a nurse anesthetist program. And so I came in, and the first thing that we started doing was doing some market analysis and presented it to the provost and said, "Hey, I really would like to make the investment to do this." And she looked at everything and said, "Absolutely." So that's incredible. It's a 2-year journey to get accredited. We just put in our initial paperwork. We have a site visit coming up in October, but we are slated to take our first CRNA cohort in August of 27.
Wow.
So that's pretty incredible.
Yeah.
Yeah.
That is an area of interest for nurses who
So
sort of enhance their skills.
yeah, it's a graduate program. So it typically requires at least a minimum of 2 years of critical care experience. And there's a huge shortage of CRNAs. And a lot of people don't realize, if you don't have anesthesia, you don't run OR cases, right? And so, especially within rural areas, about 80% of all rural anesthesia is done by a CRNA. So a lot of great prospects for jobs. It's just a really incredible field. And so now with having, infrastructure like Werner, and then our friends in medicine who just launched a residency in anesthesiology, that pairing, that interdisciplinary collaboration is going to make a really great program.
Wonderful. All right, I want to finish by asking you a couple fun questions.
Okay.
Well, I guess they're fun. All my questions have been fun, right?
They have, absolutely.
Okay. As the dean of the College of Nursing, we're in your office right now,
Yes.
and you have that title.
Sure.
So how do you allow? How do you not sort of? How do you keep an open door and encourage people to say hello and hi and form relationships with everyone when you're...
Well, it's funny. My door is open, right? If my door is open, I'm open for business, and I made that very apparent. But to be honest, I always lean back into my past kind of, nursing life where you can say to people, come to me, but they don't. So I'm coming to them.
Yeah.
So when I started, I'll never forget, I started walking the halls and just say, hello, pop into people's office, and ask them, they're like, what do you want? I'm like, I don't want anything. I just want to say hi. And they're like, okay. Kind of skeptical, right? Now it's like, oh, great, here comes the dean again, but it's important to me. So it's almost like that, morning rounds. All my nursing friends will remember that. But there has been a sense of, I think, comfort when they see me. And quite frankly, people will wait to ask questions instead of in a larger meeting because they know I make rounds and I come to see people. So I pride myself on that. I want to be really relational. I know everyone's names. I know their dogs' names. That's important because we spend a lot of time at work, right? This becomes your extended family. It's important that people feel heard, recognized here, and I hope I'm creating that culture.
I don't know if your morning rounds extend beyond the Chris and Warner, but do you have a favorite spot on campus? I want you both.
That's hard.
A hangout spot or just a quiet moment. I don't know where you...
Yeah, I visit my Jesuits very often, so Nadal is pretty incredible and special to me.
The Jesuit residence.
Yes, it's great. I spent a lot of time in Werner. Harper, actually, I loved Starbucks. So you have 5 Starbucks, John.
That's like across campus.
It is. But I get my steps in. See, right across campus. But honestly, anywhere where students are too, on the mall, and of course, Creighton Hall with those rocking chairs, pretty special.
Yeah. I was gonna say it's probably not an everyday thing when you
but
around the office.
Yeah, and the fountain, right? I mean, and of course St. John's. I mean, there's just so many incredible places where you can sneak in and really just take a moment.
Yeah.
And that's what I think is also set Creighton apart. Is that I can take the time to really reflect and discern, not only with myself but with others, and that's really important.
Yeah, I like to hide out in the third balcony in Reinert.
Yeah.
So
I've not did there.
Been up those steps.
I need to check that out.
It's quiet and
hidden gem.
Exactly, it's a nice spot.
Yeah.
Great. Well, thank you so much for your time. It's been wonderful hearing about all the exciting things that are happening in the College of Nursing, and fun to hear your perspective on your time at Creighton. So thank you so much.
You're welcome. Thanks, John.
Thanks again for listening to this episode of From the Mall. We hope you enjoyed it, and we can't wait to see you again next time.